I'm here. I'm here. I'm here. I'm there. I'm there. I'm everywhere. We're good. I'm there. I'm there. I'm everywhere. So we're good. Starting fresh. Beautiful. We had an issue with the camera there. They said I wasn't. The chair was blank. I wasn't sitting here. Maybe I'm a ghost. Maybe you don't know that. Wouldn't that be cool? If I was a ghost and I knew it? I always want to meet a ghost. That's something I always want to do. Anyway, welcome for being here, folks. Sorry for running a little late. I am Dr. Joe Esposito. If it's the first time joining us, welcome. The way we work this is I do two 24-minute segments. So what that means is I'm going to talk for 24 minutes. In that 24 minutes, you, whatever platform, on a bunch of different platforms here, you guys are going to write any healthcare questions you have in your platform. It will go to Allison, my producer behind the camera. She will then, at the 24-minute break, read me the questions. I will answer them. Then we move on to another 24-minute segment, and then I will answer your questions again. Those of you who are new to this, you'll see how other folks do it. But any healthcare questions, just send it to me. Happy to answer your questions at the break. So if you are ready, Allison, yes? Okay, ready to start the clock? Hey, folks, Dr. Joe Esposito here. I am happy that you're with me today, and I'm happy you're with me every day. What we're going to talk about today, really an important topic. We're going to talk about nutrients, bone health, and osteoporosis. Now, you're thinking to yourself, Dr. Joe, I'm a 20-year-old male. I'm not worried about osteoporosis. You should be. Because a lot of the research we're going to talk about today is showing that most people, the majority of people, are not getting all the nutrients they need to build bones. And so now is the time you have to fix these things, because I promise you, if you don't do it now, it's going to come back and bite you in the fanny, and you're going to be very unhappy. I've been in practice 38 years. I've missed a half a day of working, almost 39 years. I can say 39 years pretty soon. Let's say 39 years. Every single day, patients come to me, 7 days a week. I get it through the website and questions and everything. And they say, Dr. Joe, I have blank. What should I do about it? Many of those didn't happen that day. They happened 10, 15, 20, 30 years ago. That's when the process started. Bone health is a very insidious or slow process when it starts to fail. It doesn't happen overnight. And so if you're already diagnosed with bone issues or you're at risk of bone issues, it becomes a real serious issue, and you say, why didn't I do this sooner? Well, that's why I'm doing a show today, so that you can learn what to do so that you don't have these problems later on in life. And the same advice I'm going to give you for bones is going to help your immune system, reduce your risk of diabetes, heart disease, cancer, across the board. Not eliminate, reduce. So let's start with osteoporosis is the main thing that people talk about bone health. Major epidemic in the United States. Responsible for about 1.2 million fractures a year. Now, that's an older study. It may even be more than that now. Current management of bone loss consists primarily of estrogen therapy and calcium supplements. So if you're of a certain age, a woman of a certain age, many times the doctors will say, you know what, we tested you, you're low in estrogen, we're going to give you estrogen. There's a problem with that. And for men, I see this all the time now. They're advertising testosterone, take testosterone. If you take what's called an exogenous hormone, exogenous means outside of your body. So you take it in a pill form, a shot form, whatever it is. It goes into your body, and your body says, hey, Joe, you were pretty low in testosterone. Now the testosterone levels are perfect, or they're a little high. I'm going to stop producing my own testosterone, estrogen, whatever they're giving me, because I got too much. And if I make more, it's going to, go off the chart. So my body shuts down its own natural production. Well, why is that bad? Because now it's really hard to come off these things, because your body's not producing its own. And so now you run the risk of, if you do try to come off it, which many times you should, the body stops producing its own. The other thing that happens is if I'm taking exogenous or outside hormones, my hormone-producing organs start to shrivel up. And with men, very common, testicles will shrivel up if you're taking testosterone. So, gentlemen, you look great. You got all these muscles. You're building muscle mass real easily, because with testosterone, you build muscle mass real easily. But now your reproductive organs stop working. Well, that's a pretty big issue, isn't it? Why look good if you can't use these things? So if we're giving you estrogen therapy for low calcium, estrogen therapy increases your risk of cancer. So you start to think, wait a minute, Dr. Joe, isn't there a better way to do this? The answer is yes, in many cases. Sometimes you do need hormone therapy. I'm not saying there's no need for that. But you got to outweigh the risks and the benefits. If I took testosterone, I can get muscles and I'd look like I was much younger. and I'd have lots of sex drive, and my brain would be clear, and I'd have a lot of energy. Well, that'd be great. What's the trade-off? Testicles shrink up. Is that worth it? It's not to me. Okay? So we have to start thinking the way the risk benefits, and that's something many times isn't done the way it's supposed to in anything, whether it's chiropractic care or hormone therapy or drugs or whatever it is. So if we're going to do estrogen therapy and calcium supplements, this approach in many cases has very limited success. Another way of saying very low success. Now, there's a lot of other nutrients that make up a bone. Now, if I was going to make a cake, let's say, and I wanted to add, the flour, the sugar, not that I would do this, but, this good analogy. You add flour, you add sugar, you build everything up, and then you add like a little bit of baking powder. Let's say you're making biscuits for baking powder or a baking soda. The biscuits aren't going to rise. The cake isn't going to rise if you don't put that little bit of baking powder, I think it is, that makes it work. Just a little bit. Same thing with the bones. Bones are mostly calcium, but they have these other nutrients in them. And if you don't give the body all the right ingredients in the right ratio, it's not going to work. So you need vitamin B6, you need C, D, K, folic acid, manganese, magnesium, boron, copper, zinc. And unfortunately, the typical American diet or the typical Western diet is loaded with refined foods that are not having a lot of these nutrients in them. And if you're eating a lot of refined foods like sugar, for example, you're robbing the body of nutrients. So you're not putting the nutrients in, and you're robbing the ones that you have out. And so that's one of the reasons why you start to see things like osteoporosis set in. So it's important that you have, and then there's also risk factors like genetics, for example, age is another thing. So failure to meet one or more of the nutritional needs can result in accelerated bone damage, in this case, osteoporosis. On the other hand, supplementation with the right combination and balance and with the appropriate micronutrients may prove to be useful in conjunction with estrogen therapy and calcium therapy, or instead of. My goal is to get you healthy without the drugs, without the exogenous hormones, if we can. Now, the nice part is I'm usually right. Sometimes we need help. Sometimes we need medicine. Sometimes we need injections. Sometimes we need pain management with drugs. But in most cases, when it comes to diseases or chiropractic or whatever it is, we're able to handle it with the proper realigning the vertebrae, realigning all the joints, chiropractic care, making sure your digestive system is working, and making sure you're getting the right nutrients. So the current estrogen calcium treatment that we're using, numerous studies have shown estrogen retards bone loss. It does not completely prevent it. Fractures do occur, many times less frequently, but the fractures still can occur with the estrogen-treated women. So it's not the end-all, be-all. There are issues with this concept. The benefit of estrogen must be weighed against the risks. Now, here's the statement I want to get to. Well, calcium supplements usually be 800 and 1,500 milligrams a day. It's becoming increasingly clear that calcium alone is not the answer. Let me say that again. When it comes to bone health and osteoporosis, it's becoming increasingly clear that calcium alone is not the answer. And yet, every single patient I've ever seen in my almost 39 years of practice who has osteoporosis or bone issues says to me, Dr. Joe, I'm taking calcium. It's also the type of calcium. If you do calcium carbonate, not a good form of calcium. It can actually clog up your receptor sites and prevent you from absorbing the good calcium. Receptor sites are where things are absorbed. So calcium carbonate, which is essentially like oyster shells or chalk, not a good idea. The other thing is that if you're taking calcium from oyster shells, oysters are bottom dwellers. They filter out junk in the water. Now, if you ever read a thing called the Bible or the Torah or the Quran, early on, Moses in Leviticus says, don't eat shellfish because they're bottom dwellers and they're loaded with toxins and chemicals. This is 3,000 years ago. The water is a whole lot dirtier now than it was in Moses' time. And so if you're eating calcium supplements from oyster shells, the oysters are absorbing the waste products, the mercury, the lead, the polyvinyl chlorides, the other toxins in the water, storing it in their shell. You're grinding it up and eating it in a super concentrated form. So please, don't do calcium supplements made out of oyster shells. It's not a good idea. But again, it's very clear that calcium alone is not going to solve your bone problems. And yet most doctors give you calcium and say, see ya. That's okay. Not everybody understands biochemistry, neurophysiology. That's what I've studied for 40 years. I don't know how to operate on you. If you needed knee surgery, I would not know how to do it. I would send you to an orthopedic surgeon. If you need spine surgery, I'd send you to a neurosurgeon. It's not my field. My field is get you well and keep you well without drugs and surgery, if at all possible. So that's what we talk about all the time. Skeletal calcium depletion. So how many people are actually low in calcium? One study, several studies show only about 25% of women with osteoporosis have low calcium. That means 75% of women would not benefit at all from taking calcium if they have osteoporosis because they have enough. They just don't have all the other ingredients. Calcium supplements are found to increase bone mass in women, but no effect on the women that have enough calcium. So, we can measure calcium levels in the spine, or we can measure it in the wrist sometimes. And calcium supplementation to postmenopausal women did not significantly reduce bone loss. Calcium supplementation to postmenopausal women in most cases did not significantly increase bone mass. So everything you learned about osteoporosis and bone health so far has been wrong. Why? Because it doesn't work. So the estrogen calcium approach, giving you estrogen and calcium, could probably be improved upon if we started adding supplementation to the mix. Now, my goal would be to not get to the point where the calcium is lost. And if it is lost, what else can we do aside from giving you something like estrogen, which can actually increase your risk of cancer? Sometimes forgotten that bones are made up of a lot of things aside from just calcium. So first of all, let's talk about your diet. And research, a lot of medical research talks about the bone, but they don't talk about what caused it. The only thing they come up with is you're low in estrogen, let's give you estrogen. If you eat a high-acid diet, now a high-acid diet would mean acid foods like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, pretty much the standard American diet. If you're eating the standard American diet, you skyrocket your risk of osteoporosis along with cancer and diabetes and heart disease and obesity and brain function and Alzheimer's and Parkinson's and everything else out there. So the diet that most of us are eating many times is the cause of the disease. The simple, easy, quick, cheap fix to this issue is eat a better diet. The challenge, there's only one challenge to eating a better diet, and that challenge is bad food tastes good. That's it. It's cheaper to eat a good diet if you know how to do it. It tastes better to eat a good diet. You feel better, your love life improves, you lose weight, you go to the bathroom better, you sleep better. Nothing gets worse by eating a good diet. The only thing you're going to miss is that the bad food tastes good. And the standard American diet is essentially sucking calcium out of the bones. So a bone is an active, living, breathing tissue. And you have something called osteoblasts and osteoclasts. Osteoblasts are bones that cells that build up new bone. They lay down what's called a matrix. Osteoclasts break down old bone that doesn't really have a purpose anymore so that the bones stay fresh. So you're building up new bone and you're breaking down the old bone. That's important. Any living tissue, like any living tissue, bone has a diverse nutritional need. And for some reason, we've narrowed it down to take calcium, which, of course, as we learned, doesn't work. Failure to meet all these needs is going to be a problem. And a typical American diet is loaded with fat and flour and canned foods and alcohol and sugar and dairy. We talked about that. Requirements of certain nutrients may increase if you have genetic factors as well. I haven't even touched on genetic factors yet. So, yes, you should eat this combination to make bones grow. And that combination, by the way, is also good for every other thing in the body. But if you have a genetic predisposition to having problems, then you have to alter that plan. Now, how do you know you have a genetic predisposition? I don't know that. I don't do genetic testing. I do know that I want to err on the side of caution and do everything I can to keep my body, in this case your bones, as healthy as possible. Multiple deficiencies over a prolonged period of time can make the problem even worse. All known micronutrients. If we could somehow create a supplement that had all the known micronutrients in it, that would help tremendously. Well, the good news is there are supplements out there. But if you change your diet, if you get on eating more fruits and vegetables and nuts and seeds, and listen, a lot of you listening right now are thinking, Dr. Joe, you are so radical. There is no way I'm giving up alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. That's okay. You don't have to give it up. I just want you to make better choices. Can we negotiate on that? Bet we can. So make the better choices. The really strong acid foods, the foods that have a lot of what's called methionine and cysteine in them, are animal products. Meat, butter, cheese, yogurt, eggs, ice cream. And we're going to talk about methionine and cysteine in just a second, and how too much methionine and cysteine creates something called homocysteine. And homocysteine is an amino acid that, when it gets into the body, skyrockets your risk of osteoporosis. So if you're not giving your body the precursors, the building blocks to create the homocysteine, you don't have to worry about it. Homocysteine, by the way, also should be tested every time you have your blood work done, because homocysteine increases your risk of how much calcium is stuck to the artery walls, which can clog up the arteries and lead to heart attack and stroke. So too much homocysteine, bad. Where do we get it from? From methionine and cysteine. Where do you get methionine and cysteine from? Eating a lot of animal products. So once again, it goes back to the same thing I've been teaching for over 40 years. Well, 40 years now. Same thing I've been teaching. Cut back on your animal proteins. The ideal scenario is cut out the animal proteins. Now, I don't know if you want to do that or not. Now, I'll tell you a little story, a little side note. I was on a show the other day, and I was a guest on a show, and a guest before me had brought this big Thanksgiving dinner. It was a barbecue place, and they had beef tips, and they had meatloaf, and they had macaroni and cheese and stuffing, and they had green beans there, which were vegan, actually, so I could have eaten those. And the vice president of the company comes up to me and says, Dr. Joe, listen, we've been in business over 40 years. Big fan of yours. He said to me, he's a big fan of mine. He says, would you consider working with us to try to add better options to our menu? 40 years, barbecue joint, want to add healthier options. I was so impressed, because they realized that the trend in healthcare, especially among the younger generation, is take care of yourself. Stop killing yourself. The research is there. We know the things that can increase your risk of heart disease, diabetes, cancer, osteoporosis. We know that. And with the information age, they're looking these things up, the younger generation, and saying, I don't want this. I'm ready to take steps right now. So the food world is shifting dramatically because the buyers are demanding it. So what's it all about? How can I better sell this product? And so I was very impressed that a company after 40 years is going to sit with me and work on but putting together better options for their menu. They don't have to change their old menu, just add better options. That's how I want you to think. What can I do to make better choices, better options? Now, when it comes to bone health, it's not just thinning of the bones. It could be deterioration of the bones, wearing out. And if the bones are out of place, whether it's my ankle, my foot, my knee, my spine, if bones are out of alignment, they rub up against each other and they wear out the joints. It's called osteoporosis. Okay, I'm sorry, osteoarthritis. Osteoporosis is when the bone gets thin. Osteoarthritis is when the bones actually start to wear out. Osteoporosis always has, osteoarthritis always has a mechanical component. What that means is, with the arthritis, the bones are out of alignment, rubbing up against each other. This is where chiropractic care, spinal health is so important. If you have neck pain, back pain, shoulder pain, numbness, tingling, headache, shooting pain down your leg, anybody have that? Raise your hands. If you do, it's a pinched nerve. The most common cause, by far, of a pinched nerve is a bone out of place. So if you have pain, you should start with a chiropractic evaluation. It's the most effective, least expensive treatment for back pain, any type of pain, really, ankle pain, foot pain, shoulder pain. Come see us. We would love to do an evaluation with you, and let's determine what's the cause of the problem. If you want to make an appointment, in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Now, if you want to do a nutrition evaluation, we can do that on telemedicine, too, on a Zoom call. So if you want to make an appointment to come see us, whether it's in person or online, go to our website, drjoe.com, and click on whatever office you want to see, and one of my staff will call you back and discuss it with you. If you want to do a remote call, call my office and my staff will set that up for you. Stop suffering needlessly. The things I'm talking about today, research has shown, can dramatically reduce your risk of osteoporosis. And if you have osteoporosis, in many cases can start building bone mass again. It's not going to be like it was when you were 16. But the answer is there. We have the answer. And the studies are very clear that it's not only estrogen therapy. It's not only calcium supplements. It's a lot more than that. So you may have a genetic issue. You may have a dietary issue. You could be a lifetime of eating bad food. So if you do want to make an appointment, drjoe.com. We accept all patients, regardless of what insurance you have. If your insurance covers it, great. If it doesn't, we have payment plans available. We even have payment plans where some people are eligible to not even pay any interest for 18 months. So it's very affordable. It's easy. We have 4 offices, drjoe.com. And if you're ever in an accident, folks, if you're ever in a car accident, please, if the car's damaged, you're damaged. It's never any other way. So if the car is ever damaged, you need to come see us right away. Don't wait. I had a patient come in the other day, and she waited 5 years to come see us after an accident because they want to settle a case and get the money, and now she's on a walker. She walks with a cane and a walker. She can barely lift her leg. She's in severe pain. She didn't get the proper treatment because she wanted to settle the case and make the money. And she did. She settled the case, made the money, and now she regrets it. So now we have to see if we can piece this puzzle back together again. So drjoe.com, you can book an appointment. We got a lot to cover. In the second half, we're going to talk about what supplements, or what nutrients, I should say, should be part of your diet. Many times you can get them as supplements. But if you would, follow us on social media at Dr. Joe Esposito, all one word, at Dr. Joe Esposito. Facebook, Instagram, YouTube, we post every single day. We post health and information. It's absolutely free, of course, to follow us on social media. We would love to have you join us because it's free. If you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And we have hundreds of hours of podcasts on the podcast services, all the major ones. On our website, drjoe.com, drjoe.com, we have over 3,000 hours of podcasts. So you can search the podcast. Just type in whatever topic you're looking for in the search bar. Chances are we've done a podcast, a blog, an article. This is an amazing source of information. This is an incredible source, and it's absolutely free to you, the consumer. So drjoe.com, make an appointment to come see us. We're going to talk about supplements in just a second and what you need to be taking. I take supplements every day. Even though I have an amazing diet, I still take supplements every day. So drjoe.com is a great source of information. If you have questions, you can send them to me through the website, drjoe.com, and I'm happy to answer any health questions you might have. So let's jump right into the supplements because this is not the nutrients. You don't have to supplement all of these. They're nutrients. They should just be part of your diet. Now, vitamin K is primarily thought about to help clot blood. Now, the problem is there's vitamin K1 and there's vitamin K2, and there's different types of vitamin K2. A little confused? You should be. This vitamin is required to synthesize something called osteocalcin, and that's a protein that's found in bones. Osteocalcin is the protein that builds the matrix or the structure, the scaffolding for the bones. You need vitamin K. So what happens is, generally speaking, vitamin D3, which is important for a lot of things. One of them is it helps you absorb calcium. We're going to talk about D3 in just a second. Vitamin K2 drives the calcium into the bone matrix and increases osteocalcin so that you can actually build the bones. If you take vitamin D3 and a ton of calcium and you don't have enough K2, the calcium can build up in the soft tissues, the muscles, the blood vessels, the heart, the joints, and we don't want that. That's really dangerous. So taking calcium can actually be dangerous and counterproductive if you don't have the D3 to go with it. That's why it's so important you have both. And there's a supplement on our website, drjoe.com, and it has vitamin D3 with vitamin K2 already in it. Now, if you're eating a really good plant-based diet, you're probably getting enough vitamin K2. The problem is if you're eating a good plant-based diet, you probably don't have osteoporosis either. So that's why our vitamin D3, we actually add vitamin K2 to the supplement so that you can absorb the calcium and drive it into the bones. I've thought of everything for you. I know this is confusing. I know this is a little challenging, and I know it's hard to change your diet. So we've created protocols and formats so easy that there's no reason why you shouldn't follow them. If you have any questions, go to my website, drjoe.com. Send me your questions. Make an appointment to come see us. The supplements we're going to talk about, many of them are on our website, drjoe.com. Again, follow us on social media, at Dr. Joe Esposito. Don't go anywhere. We're going to be right back. Bam. Part 1 done. Any questions? Okay. All right. If you have any questions, folks, if you're tuning in, we're going to do another 24-minute segment. At the end of that segment, I'm going to answer any questions you might have. If not, that's fine too. Just want to let you know I'm here for you. And just type in your question through the format that you're on, and we're more than happy to answer any questions you might have. Okay? So I will take my sip of tea and do part 2. Reset the clock. Shh, Damon's sneaking out. We'll wait till Damon leaves so there's not noise to film to do part 2. Oh, Christine's coming in. Damon's coming out. We're at the break. We did a 1 segment. Now we're going to do another segment.
Put that carpet on the steps. I slid on them, not thinking they were even there.
Okay. Can I, guys, can I? Yes. Okay. Thank you. Okay. Good. All right. Ready? Let the doors close. Ready? Hey, folks. Dr. Joe Esposito here. Glad you're with us. Hey, listen. We're talking today about bone health. All of us have bones, 206 bones to be exact. Well, not to be exact. Some of us have extra bones called sesamoid bones. But generally, we have 206 bones in the body, and nobody pays any attention to them until they're a problem. And that's like saying, well, I'm not going to worry about my car until the engine starts smoking. If the engine starts smoking, then I'm going to worry about it. No, what do? You maintain your car because you're going to get more miles out of it. You maintain your heating and air unit. You change the filter. Why? You want it to run a long time. And yet, for some reason, we don't take that simple concept into our own healthcare. We wait till things break, and then we try to fix them. Many cases, it's too late. Now, I've been in practice a long time, and I've seen thousands and thousands, I'm going to guess maybe even tens of thousands of patients in my career. And so many of them come in, and they wait till it's broken, and then they say, Dr. Joe, fix me. And many times we can. But it's much better to maintain and cheaper to maintain than it is to try to fix it once it breaks. So we just talked earlier about the normal approach, the standard approach, I should say, for people that have bone issues like osteoporosis is they might give you estrogen therapy if you're postmenopausal, and they give you calcium supplements. And unfortunately, that protocol just doesn't work. Very seldom do you ever see somebody come back and say, hey, I'm healthy, my bones are healthy again. What usually happens is they don't see a lot of results. Maybe it slows down the process, maybe it improves a little bit, and that's enough for them. It's not enough for me. But if you're taking estrogen, the side effects, including cancer, can outweigh the benefits of taking estrogen therapy. So we talked earlier about that. I want to talk about supplements now, and I don't want to call them supplements. I want to call them nutrients. I want to talk about nutrients now that you need to add to your diet or make sure in your diet to not only help bone health, but overall health. So we talked a little bit earlier about vitamin K2. Vitamin K1 helps you clot blood. So vitamin K1 is important so you don't bleed to death. Vitamin K2 does something totally different. It actually helps calcium be driven into the bones and helps build the bone matrix, we call it, or the structure that the bone lays down the calcium on. So vitamin K2, if you're eating a really good, high-quality plant-based diet, that's awesome. Most people are not eating a high-quality plant-based diet, and so if you do take vitamin D3, which, by the way, you need to make sure you have enough vitamin K2 with it. It's a little complicated, but on our website, drjoe.com, we have a supplement called vitamin D3 with vitamin K2. I put it all together for you, make it easy for you. So let's talk about D3. D3 is important for intestinal calcium absorption. If you have low levels, it becomes a problem, especially a big issue in women. Factors that lower vitamin D are being older, reduced exposure to sunlight, decreased dietary intake, and the big one, malabsorption. It's not what you ingest, it's what you digest. And so many patients that I've seen over the years have digestive problems, heartburn, acid reflux, burping, gas, bloating. If that's you, raise your hands. I can't see you. If you raise your hands, it's okay. So If you have digestive issues, the chances are very good that you have some type of malabsorption problem. So heartburn, acid reflux, diarrhea, constipation, bloating, gas, you're just not absorbing your nutrients properly. And that means even if you're intaking them, you may not be digesting them. Not just what you ingest, it's what you digest. So one of the big problems is that people have digestive issues and they may not getting enough vitamin D3 or absorbing the vitamin D3 or absorbing the nutrients. And so I feel, my opinion, that part of a health protocol has to be a healthy digestive system. And I can go on and on and on about the nervous system and the parasympathetics and the sympathetics and the vagus nerve, and very few people address the digestive system. They may say, well, you have acid reflux. Here, take this medicine to help prevent acid reflux. They work for acid reflux. The problem is that if you're taking these medicines, many times they prevent you from properly absorbing calcium, B12, iron, and magnesium. So, I solved my acid reflux issue, but now I can't absorb calcium, B12, iron, and magnesium properly. B12 is very important for the nervous system, energy. Calcium, of course, helps build bones and does other things. Iron for the blood. Magnesium is probably one of the most deficient, most important nutrients we have. Magnesium participates in, I think it was over 300, the last I read, 300 different functions in the body. Alkaline phosphatase, that's an enzyme involved in forming new bone crystals, is activated by magnesium. So the enzyme that's activated to form the bones is activated by magnesium, so even if you have the enzyme, it has to be activated. The conversion of vitamin D into biologically active, what's called 125 D3, is you need calcium to make that happen. So if you're out in magnesium, you're out in the sun, you get some UVB rays, it interacts with cholesterol in the body, it converts into this new form of 125 vitamin D3. If you don't have magnesium, it ain't going to work. And so many people are deficient in magnesium. It can produce a myriad of problems, and then you become what's called vitamin D resistant. So what does that mean? You're getting enough vitamin D. You're taking a supplement, you're getting out in the sun, whatever it is, and yet for some reason, the vitamin D levels just aren't going up. It's probably a magnesium issue, not a vitamin D issue. That statement alone should tell you why it's so important to follow somebody who understands biochemistry and nutrition. Most doctors, I love my doctor friends, they're not trained in nutrition. I'll ask, I got a ton of orthopedists, neurologists, neurosurgeons, primary care physicians, I got a ton of them. And I ask them, how much nutrition training did you get in medical school? I think everyone I ever asked, the answer was zero. Zero. So here we are, we do your blood work, you're low in vitamin D, we give you vitamin D, you're still low in vitamin D. It ain't a vitamin D issue anymore, folks. Now it's a magnesium issue. Anybody ever tell you that? Nope. Dr. Joe did, though. So magnesium is so important. Most people are deficient in vitamin D, in magnesium. Typical American diet is low in magnesium. Dietary surveys show that 85% of American women consume less than the recommended daily allowance of vitamin D, of magnesium. So most people are deficient in magnesium. You don't eat in foods that you should be eating, and yet magnesium affects 300 different functions in the body. Why are we not taking magnesium? You get it from your diet. I get mine, there's two products, by the way, if you're new to the show. Two products I recommend everybody take. One is Dr. Joe's Essential Source, and the other one is Dr. Joe's Super Greens. Now, Super Greens and Essential Source, they're powders. I take a scoop of each every day, and I mix it with coconut milk, almond milk. I put it in a smoothie. Had a patient the other day says she mixes it with cherry juice and water. Some people like it with just water. However it works for you. Try different ways. I can't imagine having any day go by in my life where I don't take Super Greens and Essential Source. Now, I've been taking it for years now, and I still take it every day. It's relatively inexpensive, tastes great. There's 3 flavors of Super Greens. There's mint, there's plain, and there's hemp. I like the mint. So if you're going to start with Super Greens, start with the mint. The hemp has kind of an oaty flavor, has little bits of hemp in it, and the plain is just plain. It tastes kind of, I don't know. I don't like it as much. Now, it's our number one seller, the plain. So a lot of people like it. I like the mint personally. So we're talking today about bone health. And bones are so much more than just calcium. And the standard treatment is usually estrogen therapy if you're low in estrogen and calcium, and they send you home. But we're learning now that you need all these other ingredients to make it work. And the estrogen therapy and calcium are very limited in their success. And yet, following the protocol we're talking about here, extremely high success. But it's a little complicated. Not complicated. You have to know what to add to the recipe. And most people don't know what to add to the recipe. They take calcium because their doctor told them to. And again, doctors are brilliant. However, they're not trained in nutrition. I mean, there's engineers that are brilliant. I wouldn't trust them to remove my tooth. So just because somebody's brilliant doesn't mean they're brilliant in all fields. And that's where I come in, and my team of doctors come in, where we can step in and help you with that. Manganese, you probably never even heard of manganese, but it's required for bone mineralization and the synthesis of the connective tissue of the bones. Intake of manganese, it's really not known, but if you're eating the standard American diet, which is a lot of alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, you're not going to get the manganese that you usually get if you're eating whole foods, like unrefined grains and things like this. Folic acid. Bone health seems to be related to a role in homocysteine metabolism. We talked about that earlier. Methionine is an essential amino acid. When it gets into the body, it creates homocysteine. Again, don't worry about the chemistry here. Large amounts of homocysteine accumulate in the body if you don't have enough folic acid to break it down. High homocysteine levels are related to bone health and osteoporosis. So you got to keep those homocysteine levels lower. If you're just joining us, we also said that homocysteine, when it's high in the body, can cause calcium to stick to the artery walls. And that can lead to hardening of the arteries. And if that breaks off and the plaque breaks off in your heart, it can cause a heart attack. And if the plaque breaks off in your brain, it can cause a stroke. So folic acid is very important. Now, where can you get all these supplements that we're talking about, all these nutrients? Well, you get it from eating a good diet, but I've added all of them into Dr. Joe's Essential Source. It's a simple, easy one-stop shop. You don't have to remember homocysteine and folic acid and methionine and cysteine and metabolism. Don't worry about all that. Make sure you're getting the nutrients in your body, and it's all in Essential Source. Now, Essential Source is, I consider, granddaddy of all supplements. Because when I created this, and I created it years ago with my friend Ron in California, and when I created it, I said, how can we create a supplement where we put almost everything in one place for the general public? Now, specifically, we may have to give you other things, but generally speaking, this is the starter class, the 101, okay? Super Greens and Essential Source. So folic acid, you get it from green leafy vegetables, eating a good diet, but I've put it in the Essential Source. It's there for you, so you don't have to worry about where to get it from. Treatment with folic acid partially prevented methionine-induced raise in serum homocysteine. So if you had high homocysteine, we gave you folic acid to help reduce it somewhat. It appears menopause is associated with increased requirement of folic acid as well, and that's really important. If you're going through menopause or have gone through menopause, it's very important that you get the right nutrients. Now, here's a statement I put a star next to. Typical American diets often contain only half the recommended allowance of folic acid. Tobacco smoking, drinking alcohol, use of oral contraceptives tend to promote folic acid deficiency. So if you're on birth control pills, you're using up your folic acid. If you smoke, if you drink, if you eat a bad diet, you got to get that folic acid level, and most people only get about half of what they need. Once again, enter Essential Source. Solve the problem for you. Boron. Years ago, boron was thought to only be used by plants, but it turns out humans need it too. Supplementation of boron reduced urinary calcium excretion by 44%. So if you had enough boron in your diet, you weren't peeing out so much calcium, the calcium was staying in the bones. Who does these studies? I always wonder about that. Who sits around and measures this stuff? And also, this is a little complicated though. If the boron levels are normal, it normalizes your level of 17-beta estradiol. I know it's a big word, 17-beta estradiol. 17-beta estradiol is a form of estrogen, and it's important since 17-beta estradiol is the most biologically active form of naturally occurring human estrogen. So we can give you estrogen from an outside source, but if you have enough boron, your body seems to increase its own production. And that's what we want to see, because your body isn't going to reject your own estrogen. It's not going to lead to cancer. Taking estrogen from an outside source can. I told you it's got a good, fun, complicated show today. The amount of endogenously maintained 17 beta estradiol required as little as 5% of an oral dose. Anyway, the boron. Bottom line of that study was making sure you get enough boron. But where do you get your boron from? Well, that's where you eat a good diet from. And you get it. Now, for men, it's very important too, because it turns out that boron is necessary for us to build testosterone. And you can take a supplement called fenugreek, and some of these things advertise on TV, oh, buy our supplement, and the women like it too. Well, what it is, all it is fenugreek. And they don't have enough boron in there to actually make it work as well. All they have to do is up their boron, and you'd get a better result. And you can buy fenugreek, by the way, at a health food store a whole lot cheaper, and just take boron too. But if you're in a good diet, you're going to get enough boron. You're not going to get fenugreek, of course. So again, a little complicated, but there are protocols that we men can take to help increase our testosterone levels. There's a supplement recently that I started taking, and it's called, I can't remember now. But anyway, it actually has, I feel so much better. I feel like my testosterone levels are so much higher. Tonkat, there it is, Tongkat Ali. Tonkat Ali. And that seems to be helping. I feel great since I've been taking it. So that's another one I just added to my protocol of supplements. I'm always researching. I'm always trying to find the best treatment for you, the patient. And many times it means experimenting on me. Supplement companies all the time want me to promote their products. They want the Dr. Joe seal of approval. And I'd say 80-90% of the time they send me something, it doesn't do anything. Well, the studies show, I don't care if the studies show, it's not working. That's why all our supplements on our website are handpicked by me and monitored by me, and making sure you have good quality as well. Make sure you're getting quality supplements. My German grandfather always said, always buy the best, it's always cheaper. And I love that line. Always buy the best, it's always cheaper. That goes for healthcare too. Chiropractic care, brain surgery. I wouldn't go to a discount brain surgeon and say, hey, I got a tumor. Can you remove this tumor? Oh, you're cheapest? I'm going to go with you. I'm going to go to the best. And there are clinics that you can walk into and get chiropractic care, and that's fine if you want to do that. However, my health is so important, I want to pick out the best doctors I can find. I know the neurosurgeon I would go to if I had a spinal injury. I know the orthopedic surgeon I would go to if I had a knee injury. I know the dentist I go to, because I go to him all the time anyway. Not all the time, but he's my regular dentist. I pick the best of the best. And I can choose to go anywhere I want and get any treatment I want. That's why I take the supplements that are on our website, drjoe.com, because I vetted them and I know they're really good. I created Super Greens and Essential Source. I mean, it's just mixing ingredients. I know it's good. So if you're looking for supplements, go to our website, drjoe.com, click on a store. We have over, I think, 19 or 20 different supplements, and read what they do. And if you have questions, you can send them to me through the website, drjoe.com. I'm happy to answer any questions you have. But the most important thing that you can do for overall health is come see us. Now, again, if you need a gynecologist, I'm not a gynecologist. You need a dentist, I'm not a dentist. But overall general health would be a good idea. But if you have pain, neck pain, back pain, shoulder pain, headaches, numbness, tingling, car accident injuries, sports injuries, that's where you need to come see us right away. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb, and I would love to have me and my doctors be your doctors. They're my doctors. I want to share my doctors with you. And these are the people that I trust, the men and women I trust, taking care of me every single day. And so if you're ready to get well and stay well, if you have a health issue, go to the website, drjoe.com. Normally the first visit is $910. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. We've reduced that to $299 for my listeners. So if you're serious about wanting to get well, go to the website right now, book an appointment. You can call us or book it online, either way. My doctors fill up very quickly. So if you're serious, you want to make an appointment right away. I like my doctors. They are my doctors, actually. They take care of me. So drjoe.com. We accept people with all insurances. Now, it depends what your insurance covers. We accept you. It depends what it covers. If you don't have insurance, you have one of those stupid high deductibles, which so many people have now because insurance is just insane. we have payment plans available, and many of you are available to make 18 months with no interest payments. So we're going to make it every way possible for you to come see us. And it's the most effective, least expensive treatment for back pain. So why wouldn't you do that? I don't know. Always buy the best. It's always cheaper. That's what Grandpa always said. So drjoe.com, we'd love to see you. And if you're ever in a car accident, please, I'm begging you, come see us immediately. Don't waste time. You might get phone calls from scammers. Hey, this is Bob. I'm from your insurance company. Go see doctor whatever. That's a scam. No one's ever going to call you and tell you to go to an attorney or a doctor. That's a scam. Don't fall for it. So drjoe.com, we'd love to be your doctors. All the supplements we talk about, the Super Greens, the Essential Source, the Vitamin D3 with K2, all of them are on the website, drjoe.com. You can order and pick them up, or we can ship them to you, whatever way works for you. If you get on automatic shipment, it's even cheaper. Automatic reorder, you can cancel at any time. There's no contract. We just want to make it as easier for you and as easy it is for us. So we're talking about bone health today, and it's so much more than just calcium. In fact, the whole concept of taking calcium for bone health doesn't work. You have to have all the ingredients to make it work. Silicone. Silicone appears to strengthen the connective tissue. And other nutrients, along with this, silicone or other nutrients, you can have what's called a subclinical deficiency. Now, what that means is subclinical means there are no symptoms, but you have the deficiency. And so that's why it's important to work in a proactive way to keep your body healthy so you don't go into a subclinical deficiency, which then leads to a clinical deficiency and leads to some serious issues. So that's why I'm trying to teach you. Work on getting well every single day. Minimum supplements, Super Greens, Essential Source. If you don't know what to eat, go to our website, drjoe.com. Type in, so what can I eat? Type that in a search bar, so what can I eat? Listen to a lecture that I did. It talks about breakfast, lunches, dinners, snacks. I've written books on it. Eating Right for the Health of It, Prescription for Extreme Health, all covered in my books. The answers are there. You don't have to look any further. I'm happy to share them with you. But the most important thing you do is make an appointment, drjoe.com. So B6 is also very important. Most people don't get enough B6. Biochemical evidence of B6 deficiency is found in more than half of a group of participants that were considered healthy. We add B vitamins to our Essential Source. I also take Dr. Joe's B complex on top of it. I take another supplement called nitric oxide. Nitric oxide increases your circulation, opens up your blood vessels to your brain, your sex organs, your heart, your lungs, your bones, increases circulation. As you get older, your nitric oxide levels are plummeting. It's called aging. We can boost that back up by taking a supplement. And that's why I take nitric oxide as part of my protocol too. I take omega-3 fatty acids. I don't know why all of you are not taking omega-3 fatty acids. It's essential. It's necessary to stay alive to get omega-3 fatty acids in your diet. Most of you are not getting nearly enough. I take 1 gram a day. The bottle I say take 1 a day, I take 2 a day. The omega-3 fatty acids are so important for brain health, for anti-inflammatory reactions, for overall cellular function. And most of you are deficient in it. And we have an answer. Take omega-3s. And they're on the website too, drjoe.com. Zinc is very effective, very necessary for bone health. It's also necessary for immune system health. Many of you are zinc deficient. If you like Brazil nuts, you know what they are, Brazil nuts? Have 3 a week. 3 a week is all you need to get enough zinc in your diet to keep your immune system strong and keep the bone health where it should be in most cases. So it's not really hard to do. It's easy. Vitamin C. Vitamin C deficiencies can be a problem. And as you get older, the big problem becomes absorption. So one of the ways we know we're not absorbing is symptoms, gas, bloating, diarrhea, constipation. But if you have acid reflux, heartburn, burping, gas, bloating, the stomach, which is supposed to sit below the diaphragm, can push up into the diaphragm. 85% of the patients that I've tested in my career have this problem, myself included. And yet it's totally ignored. They give you medicine to shut down the acid reflux, to treat the symptoms, but very few doctors ever address actually taking the stomach and adjusting it or pulling it down away from the diaphragm. All my doctors are trained to do this, and I trained them because they do it to me. I'm getting older. My muscles are getting weaker. I want to keep everything working the best it possibly can. So, folks, I'm almost out of time. If you have any questions, send them to me through the website, drjoe.com. I'm more than happy to answer them for you. There's a little bot that pops up. Hey, want to talk, chat? Send it through there. It says contact us. Either way, it comes to me personally. Happy to answer your questions. To make an appointment, we have offices in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. Just click on the office there and make an appointment to come see my doctors. We're happy to do what we can to help get you well and keep you well. Again, the supplements, folks, why you're not taking supplements, I have no idea. They're on the website too, drjoe.com. Follow us on social media at Dr. Joe Esposito. Tell your friends about the show. Catch you next time. Bam. Questions?
Yes. So do you have any tips on healing a fracture? And also, do you have any supplements that you would consider as essential?
Yes. The fracture is everything we just talked about here, building bone mass. So this show is going to be on the website, right? We store this on the website? Yeah. If you go to our website, go to SoundCloud, just put in today's date. Okay, today's date, and you'll see it. Listen to it over and over and over again. It's all there. Supplements that are essential, yes. Super Green's an essential source. That's why I called it essential source. Vitamin D, absolutely. Adrenal support depends on your age. If you're over 30 and you have any type of stress in your life or you do any stimulants like coffee, you should be taking adrenal support. Omega-3 fatty acids, they're essential. They're called essential fatty acids. So if I had to pick an essential protocol, Super Green essential source, vitamin D, omega-3s, and adrenal support, if I had to pick them. So, but listen to the show again. That's how you build bone mass and get those fractures to heal faster. So, what else?
That's all.
That's all. Okay. Great, guys. I do appreciate this. Hey, listen, this Sunday I'm not going to do a show. They got some basketball on in WSB Radio, so they're going to bump my show. So any questions, send them to the website, drjoe.com. We are doing something called Holiday Hackathon. It's going to start next Monday. Not today, but next Monday. It's 4 days, an hour a day. It's absolutely free. We'd love to have you join us. So all you have to do is send me a message through the website, put holiday in the message. I will send it off to my associate, Donna, and she will send you information about it. It's absolutely free. As long as you're registered, if you can't attend, we will send you the replay of each day. Can't make it easier for you, folks. It's going to be surviving the holidays, the things you need to do to make it through the holidays. Please tell all your friends. Everybody send me a message. Says holiday. We'll send you the information and register. Again, it's absolutely free. There's no sign. All you have to do is sign up. That's it. So love to have you there. Hopefully, I will talk to you then next Monday when we have our first day of the hackathon. Talk to you then.